Thank you very much, Felice, for this introduction. I think you've already indicated reasons for smoking cessation, but we have to then put this into context to indicate how in practice this happens. It's not easy to talk about cognitive behavior therapy in a lecture form. It's usually best to do it in a workshop where you can give practical examples and also make reference to positive results that other people have had. Can I have the first slide, please? I think it's important to first understand the definition of smoking cessation. This refers to the process of quitting and remaining abstinent from tobacco products. And I want to just repeat this because when it says tobacco products, it means all ranges of tobacco products, because some people who may come to seek help to stop smoking may have been using combustible tobacco. Some may also have been using alternative methods like vaping and so on. Some may be actually using a combination of both. So one has to structure the intervention in such a way that it addresses the needs of the particular client or individual. Smoking cessation requires commitment, support, and strategies to overcome nicotine addiction and smoking habits. This implies that the key element that people seek in smoking is the nicotine that is contained in tobacco. Unfortunately, in combustible cigarettes, this is accompanied by all sorts of toxins. But around the smoking itself, people tend to develop certain behaviors. They know that they're going to eat, or when they're going to drink, they'll smoke, or when they're with friends, they'll smoke. And these are some of the things that cognitive behavior therapy targets. Smoking cessation also needs some understanding of why people smoke and the choice of nicotine source they prefer. For instance, why do some people want to stick to combustible tobacco? Why have some also tried alternatives like heat-not-burn, vapes, and so on? There is a reason behind this, but at the end of the day, all the individuals want to get some calmness, some relief by using these products that deliver nicotine in various ways. There are multiple approaches, including cognitive behavior therapy, which are used to assist individuals to stop smoking. Now, I think this is important because cognitive behavior therapy is very structured. It has a time-limited, application. You set the number of sessions, you agree on that with the client after full assessment of the client or the individual that you're going to assist. It's very, very important to note that there are other methods like short-term psychodynamic psychotherapy, a lot of metrics of other interventions, psychological counseling, supportive therapy, and so on that can be used. But if you're using cognitive behavior therapy, you have to understand it very well. You have to know the principles that are involved in it. Next slide. There are reasons for smoking, and people will give you so many reasons, but generally, they tend to smoke to reduce anxiety that tends to interfere with their smooth execution of tasks. They suddenly feel tense, they feel headachy, they feel that they cannot cope with whatever they're doing unless they smoke. And after smoking, they feel better. But that feeling of calmness may be short-lived, and sometimes people therefore end up smoking more frequently. Every hour they're smoking, some of them become chain smokers. Anxiety can also be coupled with different degrees of depression. This is a common situation where a depressed individual also is very anxious, and under certain circumstances, faced with pressure, they then tend to want to smoke, and they think that will make them feel better. Patients with psychosis, for instance, such as schizophrenia and bipolar mood disorder, tend to smoke a lot by using cigarettes only and also mixing with alcohol to feel better. And the example that shows you that there is some calming effect of smoking on patients with psychotic disorders. Some of the hospitals in the UK have also tried to allow some degree of use of vaping, which are alternatives that are supposed to at least deliver cleaner nicotine that is not coming out together with toxins that you find in combustible tobacco. And some of these patients, if they don't smoke, they become more restless and they need more medication. But if they've had their nicotine fix, you find that sometimes even the medication that they need is reduced in terms of dosage. The smoking behavior is liked really because of the need for nicotine, which seems to have a calming effect, particularly amongst individuals with high levels of stress. And I think this is important because many times we are dealing with a debate that says perhaps nicotine itself can be harmful in various ways. What really is a problem with nicotine is that it is addictive. When people use it more and more to try and calm themselves, they tend to want to stay on it until they realize that there are other health problems that they may have. For instance, chronic lung diseases, cardiovascular problems, and so on. So there are a number of techniques to assist stopping smoking. Therefore, these are target the uncontrollable desire to smoke in order to reduce tension, headaches, and just to feel better. There are people who will tell you that they like smoking, they've been smoking for many years, and they don't want to stop because it makes them feel better and they've not had serious problems. But generally, people who come to seek help are those who feel that they've encountered serious physical and psychological problems, and they need help to either stop completely or to reduce the degree of smoking. Next slide. So there are approaches directly or indirectly embedded in CBT, that is cognitive behavior therapy. It will include the following. Once you receive a client who seeks help, there has to be a number of principles, and these are embedded in CBT, as I'll explain later. For instance, setting a quit date and marking it on the calendar. So the person has a target that by such and such a date, I will either have stopped smoking or I have reduced the number of cigarettes or that I use per day. Getting support by sharing your decision and with friends and perhaps family, and joining support groups. I'll refer to this again later. Identifying triggers that make you to want to smoke and develop a plan to avoid or manage them. Now, this is crucial because when one talks about triggers here, we're talking about situations under which people may feel anxious and more anxious. And for them to reduce that anxiety, they think that smoking will help. And of course, when they do smoke, they feel a little better and they continue with what they do. There are also examples in the realm of use of nicotine replacement therapy, NRT, e.g. nicotine gums, lozenges, patches, or inhalers to manage withdrawal symptoms such as irritability, poor attention, sweating, and headaches. When some people try to stop on their own, they have these withdrawal symptoms. Or if they have not smoked for a long time, say you've been flying on an aeroplane for a long distance and so on, or you are in a meeting that doesn't allow you to go out to smoke, you may have a feeling of withdrawal, such as irritability, poor attention, and so on. So these are people who may want to use gums or lozenges sitting in whatever place where they are, and they tend to feel better sometimes. The next is the use of non-nicotine prescription medications such as bupropion, varenicline, to reduce cravings. The key issue here is that you have triggers, but you also have cravings that you have developed because you've been using the cigarettes for a long, long time. So when people then smoke, they think that it improves their mood by engaging in various things. But to reduce the cravings, you can engage in physical activity as a distraction from cravings. Not everybody wants to exercise daily, but this is something that one encourages people who smoke a lot to do. Instead of going for a smoke, why not walk? Why not do some light exercise? Reward yourself for celebrating periods of non-smoking. So some people don't realize that little short periods of non-smoking should be celebrated. If you've been smoking daily and suddenly You can go on for a week or two without smoking. You have to be happy about that. Share that with friends and family, and perhaps reward yourself in any particular way. Be patient and deal with relapses. Now, most people are in a hurry, get into a session, and within a week or so, they want to have 100% results, being those of either having stopped completely or having reduced seriously. Sometimes it's not easy. Hence, there is, as I'll indicate later, a need to plan, to have a relapse plan. You may consider alternative methods such as hypnosis, acupuncture, and counseling. So what I'm trying to say to you is that these strategies, directly and indirectly, are embedded in cognitive behavior therapy, in the sense that someone teaches a person or individual who's addicted to smoking a particular technique to apply on his own or be guided in terms of its application. You also have to learn to avoid places where you might be tempted to smoke and remind yourself of the reasons you quit. If you don't do that, sometimes you fail to know why you actually sought help to stop smoking. Next slide. So there are some CBT principles that are involved in smoking cessation, and we can discuss this in detail later. Firstly, you have to identify and challenge smoking-related thoughts and behaviors. Are the slides still on? Ferris, do you still see the slides? Yes, thank you. So the CBT principles in smoking cessation include being able to identify, help the individual identify and challenge smoking-related thoughts and behaviors. And this implies understanding of the interconnectedness between thoughts, emotions, and actions. You have to become aware of the triggers and coping mechanisms. If you've noticed that this might trigger, can you plan in advance to develop a particular coping mechanism? If you come to therapy, you may not have these mechanisms. So you come to therapy to learn new skills to manage cravings and emotions, which obviously help you to deal with the triggers. You then have to also be assisted in developing a relapse prevention plan. These are the elements of CBT that are very helpful to those individuals who seek help in terms of wanting to smoke. A number of techniques are applied. One of them, that is techniques of CBT in smoking cessation, will include cognitive restructuring, identifying and challenging negative thoughts about quitting, e.g., I will never be able to quit. Now, the therapist's task here is to enable, to assist the individual client to understand that that statement is too strong. There is a possibility of looking at things differently. For instance, if they have identified the triggers and they've identified the thoughts that go along with those triggers and emotions that come out, it's important for us to know that the action is going to smoke. Most people don't understand that those actions are related to the thoughts that they have. There might not be any problem, but they have this fear of impending failure, a fear that they may not succeed with what they're doing at a given time if they don't smoke and they don't feel better. The other technique that is used to assist individuals is self-monitoring. They're encouraged to keep a smoking diary to track patterns and triggers. Now, this is almost like a written, rational self-analysis in the sense that you're asking a client to keep a diary, but they don't keep the diary for themselves. Every time they come to a session, they must show you what they've recorded in that diary. And then you can take them through what may have gone wrong at a particular point, and then help them look at an alternative that would have helped them reduce or avoid smoking, even without using medication and so on. The next technique is stimulus control, where you ask the client or patient or individual to remove related cues, such as ashtrays and lighters, because when you see these things, you just want to smoke, because that's a behavior that is already embedded in your thoughts, and it's almost like happening compulsively. Maybe at that time you're not necessarily anxious, but by virtue of seeing the ashtray or the lighter, you want to smoke. The therapist will also help the individual with relaxation technique, deep breathing, for instance. Instead of running out of the plane to collect your bag and go out to an area where smoking is allowed, why not breathe in and out a number of times, or do some progressive muscle relaxation. You may want to be seated somewhere to do some mindfulness meditation. Some of these little tricks have to be taught the client in the session. The next one is problem solving. Identify and plan for challenging situations. For instance, if you are going to meet with friends who are drinking, you may want to join them in drinking, but then they're also smoking, and you may think that you just find yourself smoking. But the truth is that you knew that this was going to happen. How do you prepare yourself for that? So the duty of the therapist here is to encourage people to understand that that will be a challenging situation, and they have to plan ahead to resist, just following through with smoking. The other important technique is social support. Encourage support from family, friends, or support groups. There are people who listen well to their family or friends, but there are those who function better or who learn better when they're in support groups, because in support groups, you suddenly find that you are not the only one who's struggling with stopping to smoke. There are other people who feel that they should be assisted, and they present their problem in different ways. They may also present different triggers, and you may say, but wow, I also have those triggers. How can I stop? Coping skills training is another important technique. You have to learn skills to manage cravings, stress, and emotions. I think this is key because the driving force is this cravings and the stress that you build up. And sometimes the stress is not really a positive stress in the sense that it's not the kind of stress that makes you work, but it's a stress that hinders your ability to focus. So you have to teach the patient to analyze his thoughts, the situation is in, and why he reacted in the way he did, which is going to smoke. As a therapist, we have to do some kind of motivational interviewing where you encourage the patient to motivate himself, or you motivate the patient to quit. I think that's very, very important, but there is training, obviously, for motivational interviewing. It's very elaborate training, but once you know it, you easily include it in the implementation of techniques for CBT in smoking cessation. Next slide. So the structure of the session of CBT may look like, firstly, you don't just start. You have to do initial assessment and set goals with the client or the individual who seeks help. For instance, they have to understand that they are going to be taught how to be independent, how to apply these techniques on their own to themselves so that they can either stop or reduce smoking. But they'll be guided in a steady, in a very systematic way by the therapist. They have to, the next session might be one where you want to help them identify triggers and coping mechanisms. And this is very important in that people don't seem to realize that there are triggers. And one of the ways of helping them identify these triggers is keeping this diary I mentioned before. Where were you when you realized that you were smoking a lot? What was happening in that setting? What did you think about what was going on there? How did you feel? Because normally people will tell you about how they felt. They felt bottled up, they were tense, they felt a bit of a headache, but they don't know what preceded that headache, the thoughts that preceded that, and the emotions that they have seemingly are just out of the blue, but they are never out of the blue. Those emotions and actions are triggered by the thoughts that they have about the actual situation. So they have to be taught new skills and techniques of dealing with these negative thoughts. They're practicing skills and homework assignments. A number of times people think that therapy only happens in a session in the therapist's office or at the hospital or the clinic. Normally, because cognitive behavior therapy is directive and structured, people are also given assignments to do at home. For instance, keeping the diary. Secondly, being asked to expose themselves to certain situations where they normally get triggered to smoke and see how they cope with that, and write down their exact feelings at the time that they are in that situation. But the next important one is to monitor themselves, progressive monitoring and evaluation. But this is jointly with the therapist. For instance, the client will come and say, I have tried this and that, and I know that I have improved to this extent. They can be validated by the therapist who notices some changes and so on. And in terms of response to questions, those changes become very clear. What is also important is that the patient or the client must understand that addiction to smoking, it's a serious thing, and there are chronic relapses. It's a chronic condition with relapses. So you have to plan relapses and assure the client that when a relapse comes, that doesn't mean he or she failed, but that maybe the situation was difficult. And the idea is to reanalyze that situation, go back to some of the earlier stages in the CBT session to help them understand how to properly analyze the given situation and move forward with intervention with some of the coping mechanisms that they've been taught. Next slide. So there are some benefits of CBT in smoking cessation. What the literature shows that it leads to increased quit rates. Those people who come into, who are prepared, and they have to be prepared, and that's part of the analysis at the beginning of the session, that they are ready to be assisted and assist themselves. It can lead to increased quit rates. It also improves, coping skills. And these coping skills tend not to just relate to smoking, but they tend to generalize into the general lifestyle of the patient. The patient will also indicate that he has noticed improvement in certain things that he was not able to do because he was smoking a lot. Enhanced motivation, they will tell you how well they have developed the desire to re-engage differently with smoking. But this was because of the guidance that the therapist gives in cognitive behavior therapy sessions. That motivation doesn't just come automatically because it was not there at the beginning of the session. I think it's important also to note that the benefits of CBT in smoking cessation, it's long-term maintenance of abstinence. This is a key important issue because when you say long-term maintenance, you are saying indirectly that in between or after maybe a few years or so, there can be a relapse. I can give you an example now of a CEO of a rehabilitation center I visited just to see what they do, the kinds of patients they admit. It's an alcohol and drug abuse rehabilitation center. When he was showing me around, he was happy to tell me that he has been sober for 24 years. But when you moved in the grounds, moved from one area to the other, showing me different rooms, I noticed that he would then walk out to go and smoke a little bit and then come back and we continue. So I asked him a question. You've done very well in terms of stopping to drink. You're free now from overuse of alcohol, but you seem to be smoking a lot. Have you tried to deal with the smoking? Have you tried alternative methods? For instance, have you noticed that continuous smoking is harmful to your health? He sat down and said, I was just happy to stop drinking because I think it wrecked my life. But I didn't realize that smoking could also interfere with my health. I have noticed that my breathing has been problematic and so on. And someone had suggested that I use alternative methods like vaping, but I'm scared. But that person is a person who has been able to deal with drinking. Why can't he now be assisted to deal with smoking, which was really almost like chain smoking? If you're smoking every time you walk around, within an hour you're smoking, when you eat you're smoking and so on. that is problematic. So CBT can be used on its own, but it can also be used with other interventions such as medications, nicotine replacement therapy, as I've mentioned before, medications like bupropion and others, antidepressants of different types. So sometimes we target the underlying problem like depression or anxiety, but when you do that, you're also decreasing the cravings for cigarettes or smoking. Inclusion in support groups. These support groups will also be directed, which implies that CBT can be applied with individuals, but it can also be applied with groups. But in a group setting, obviously, you have a little more work as a therapist to do because you have to deal with the responses of different people who may have had a problem with smoking for different number of years. And so the intensity of your intervention might be a little higher. There are, in some other places, telephone quit lines. When they're available, they're asked to, instead of rushing to smoke, perhaps make a call, talk to someone who will be online to assist them. And more, with advancing technology, there are mobile applications which clients or individuals can use to see how far they're progressing, to learn more techniques of coping with their emotions, with the anxiety, with the tension or stress, such that they can function a little better. So all these things are important, but the therapist has to know very well and tailor the therapy, the cognitive behavior therapy approach to the particular client. So in the next slide, the effectiveness of CBT in smoking cessation has been properly assessed, and I will not give references here, but it significantly increases quit rates. It's effective in both individual and group formats and can be adapted for adverse populations, for instance, adolescents and pregnant women. We know that we worry about pregnant women who are smoking or who are drinking. So we can apply behavior techniques of CBT to assist them to reduce or stop the drinking or smoking during pregnancy. Same applies to adolescents. But of course, with adolescents, in most cases, they don't easily refer themselves. They'll be referred by family or friends to seek help if they are over smoking. And that can be seen in terms of certain behaviors like stealing money to go and buy cigarettes, stealing money to go and buy alternative methods such as vapes and so on. It is a powerful tool for personal growth and change. And I'm mentioning this because, as I pointed out earlier, a CBT, once you apply it for smoking cessation, you tend to realize change in other aspects or domains of your life where you are not doing well, or that you even didn't notice that they are hampering your ability to move forward. Suddenly you see some positiveness there. It helps you to understand the interconnectedness of thoughts, emotions, and actions. And it helps you to focus on the present moment experiences and situations. Now, this is the beauty of CBT, because you set a number of sessions, you agree whether it's going to be 8 sessions or 12 sessions or 15 sessions, or it could go up to 20, depending on your initial assessment of the client and how much you think this client will need in terms of learning skills. Sometimes, even if set yourself, say 10 sessions with a particular client or individual, you find that during the period of consulting, they also tend to relapse and they're shy about it. But when they talk about it, you may want to go back to the previous steps. Firstly, for instance, identifying triggers again, identifying the emotions that go along with those triggers and the actions and how they can deal with those based on the coping mechanisms that you have taught them. So it's a very, very structured issue. So just to conclude, I think CBT is effective on its own and or in combination with other interventions, as we've mentioned, nicotine replacement therapy. Some people will do acupuncture, some people go for hypnosis. But the beauty of CBT is that you have a therapist with knowledge who will be guiding the person or the individual in a structured way, patiently evaluating and re-evaluating the progress that the patient is making or the client is making. And I think it's very, very important to notice that, because some people think it's lifelong. It's not lifelong. It's structured, time limited, and so on. And the aim is to make the individual independent and to be able to manage triggers and cravings by following guidelines given. This is crucial in the sense that what you are saying here is you don't want the client to be dependent on you. You don't want to create another form of dependency. You want the client or individual to be independent and apply the coping mechanisms that you've taught him or her on his own. So some people talk about written rational self-analysis, which is very important. This diary keeping that I've referred to before, it's a very crucial method of going back, sitting down and say, but where did I go wrong? I was doing well for the past 3-4 months, but suddenly I'm back at it, and why? What are the triggers now? Am I experiencing new stresses? Am I facing new challenges? But if you analyze that based on what you initially taught, you find that you can easily consider the mechanisms that you were taught in terms of how to cope with these tempting situations. So it can be part of other psychological interventions where you teach the individual coping skills. So you may be doing short-term, psychodynamic psychotherapy, but you may want to impose the certain principles of CBT, which could be didactic. You are teaching the client how to respond to this type of stressor, how to avoid just rushing to smoke because you feel tense, you have a headache. How about sitting down and doing some breathing exercises or muscle relaxation exercises, or finding a quiet spot for mindfulness, meditation. All those skills put together can assist, and they can speed up the smoking cessation intervention. Just a final word is that we hope for complete cessation. However, in most cases, it's not like that. People will reduce their smoking. There are those who will luckily just stop completely. But also, there are those who will insist on coming for therapy, but still using alternative methods such as vapes, heat not burn, methods and so on. That is looking for cleaner nicotine. But generally, people will also give you an impression of how their health has improved because of their exposure to CBT, being taught techniques of coping with various stresses, emotions, and their fears, because that's one of the problematic issues, because most of the fears are not based on reality. And that's what you have to teach the client in sessions of psychotherapy, of cognitive behavior therapy. I'd like to stop here, and perhaps we can discuss using questions and answers to elaborate further on some of the elements of CBT. Thank you very much for your attention.